Good day, friends of Buzzy. If you have been joining our COVID-oriented podcast for a while, you know that when I'm wearing my doctor coat, I'm going to be very serious and talk about very doctory things. Today, we are going to talk about myths, misconceptions, and the reality of needle fear when it comes to COVID vaccination. As you know, I have been working on needle fear for 15 years, and I'm very disappointed with the media coverage that needle fear is getting. It seems that despite the fact that needle fear has been increasing 252% in the last 2 decades, it's only now being recognized that maybe it could be an issue for COVID vaccination. So I want you to think about Operation Warp Speed. What if we've got a disease that is threatening the planet and we come up with a vaccine in record time and we can't get enough people to vaccinate to get to herd immunity? We've got all the vaccines we need, we've got everybody lined up, and half of them leave the line. So that's what we're talking about. And some people are like, well, this is the conspiracy theorists. This is the 20% of people who are never going to get a vaccine. This is people who think it's autism that's the problem, that there's really a risk of danger from vaccines and they want to wait. But you know what? It actually isn't any of those. The real answer to why people say they may not get vaccinated is rooted in something that started in 1982, and it's something that we can address. It's needle fear. This morning, I saw a headline that the CDC estimates 7% of people have needle fear. Well, first of all, if you go to the CDC website, they actually accurately state that about 24% of adults have needle fear. Could be up to 28% now, but regardless, that part's accurate. What they don't talk about is what has actually been proven about how people get fear, what fear is, when it comes about, and what you can do about it. So let's talk about some of the myths and misconceptions of needle fear. And to do that, I'm going to show you this lovely slide that shows me being a doctor and giving lectures at places. All right, so let's go there. So yes, I'm a doctor and pediatrician, and I've done NIH-funded work in needle fear. The thing that you need to know is that we don't have a lot of empathy for needle fear in our culture. When I show this lecture slide, people laugh because if you're in medicine, you just don't get it. If you've spent all your time trying to make a vaccine to save the world, it's literally impossible for you to understand that there are people who would leave the line because they don't want to get an injection. The reality is that people today are more afraid of needles, but you can't ask, are you afraid of needles directly? Because often the stigma against being a wimp or being afraid overcomes what people are willing to say. In 1995, 10% of adults and 25% of kids were estimated to be afraid of needles. But by 2020, when people were asked in studies whether or not they minded needles, 28.4% of adults and 63% of kids said they were afraid. So to back up a little bit, what happened? Is this because of too much reality TV? Is this because back in the 70s and 80s, we only had Pong and now we've got much better video games? What's the correlation? Well, it turns out that the correlation is pretty obvious if you think about it. Before 1983, there were only 6 injections you got as a kid, and they were given before you were 2 years old, so you didn't remember. But by the year 2000, we were able to save so many more lives, and we did it through vaccination, that by the time you're 6 years old in the year 2000, you got over 36 separate injections. Now, to be honest, as a pediatrician, I can tell you, you can stick them like a pincushion before they're 2, and it doesn't matter. You protect them, you go for it, and they don't become afraid of needles. But what has happened is that we have started giving injections when people are old enough to remember. So here's the deal. We are now giving injections when people are between the ages of 4 and 6, they're getting their boosters and they're getting held down and they're old enough to remember, but they are too young to abstract. So what this means is they don't realize that this is something that's going to protect them. This is that booster shot that's necessary for the immunity to really kick in. They're at their doctors. It's supposed to be somebody who takes care of them, and they're being held down and repeatedly stuck. So what we found in our study when we looked at needle fear by birth year, not by age, was that it had a 0.87 correlation with the vaccine schedule. Now, let me be clear. I am totally 100% pro with the CDC vaccine schedule. That's the way to do it. That is the science. But for the booster shots, you've got this 3-year window from when they turn 4 until the end of their 6th year that you can give the vaccines. So these 4 to 6 year vaccines, actually you got a lot of time to still be within the science and spread it out. We'll talk about why that matters, but before I do, I want to give you a little thought experiment. Imagine you're 5 and you're going camping for the first time and you get stung by a wasp. All right, one wasp, shake it off. You know, sometimes that happens when you go camping. But now imagine that your first time you go camping, you get stung by 5 wasps. You're going to have a really different feeling about going camping the rest of your life. And it turns out that that's what the needle fear experience is like. If you get multiple injections on the same day, your memory and your experience and your willingness to go to the doctor again are really different than if you get just one shot each time. It's kind of like if you went to give blood, and every time you go to give blood, Exhibit A, every time you go to give blood, you get a needle. And you go to give blood 5 times, you get 5 needles, no big deal. If you go to give blood and it takes them 5 sticks to get the vein, that's a really different experience, and you're going to go to a different phlebotomist or you're not going to go give blood again. So it's the same thing with the way that we're giving the boosters. So let's look at research that we did when we first started with Buzzy for adolescent injections in 2012. Turns out that 63% of, well, turns out that of 120 kids, the average amount of needle fear they had on a 10-centimeter scale was 63 millimeters. And if you look at who said they were afraid of needles, it was even worse than that. It was 118 out of 120 said they were afraid of needles. This was dramatically different than what it should have been. It should have been about 25%, right? That's what has always been said. But these kids in our study overwhelmingly were afraid of needles. At the same time, a doctor named Anna Taddeo in Toronto interviewed over 1,000 adults and children. And she found that instead of it being 25% of kids were afraid of needles, it was 24% of adults. And instead of it being 25% of kids, it was 63%, almost exactly the median number of fear that I had found in my study. So I went back to the data and looked at these kids' immunization histories to see what was going on. And guess what I found? What we found was that if they got 1 injection every time they went to the doctor, none of those kids were in the highest quartile of fear when they were in the preteen years waiting for their HPV vaccine. Now, if they had gotten 2 injections every time they went to the doctor, or the max number was 2, about 9% of them were afraid. The kids who had gotten held down and got 3 injections, 26% were in the highest group of fear. But for those kids that had 4 or 5 injections on the same day, fully 50% of them were in the highest quartile of fear. And what's more, these guys were 2.5 times less likely to get their second HPV vaccine. So one of the things that people say when they're talking about needle fear is that it's something you grow out of, that it's something that's related to fainting, or it's something that is a very small percentage of the population. That used to be true, but what is true now is that we've created a generation of kids who got multiple injections on the same day, and rather than building resilience, like those kids that got one wasp every time they went to camping, and they just have learned how to rub it and go on with it and get over camping. The kids who got one injection every time they went to the doctor in those 4 to 6 year time period, they learned how to rub it and get over it and built resilience. But the kids whose defense mechanisms were overwhelmed, those guys are still afraid of needles. They were still afraid of needles 5 years later, and they're afraid of needles now as adults. The thing is, those people who are afraid of needles as adults might attribute it to something different. So I think one of the purest ways to look at this is that when asked why people didn't get their second HPV vaccine, the number one reason kids gave was that they were afraid of needles. Now, this tells us a couple things. For one thing, it tells us that a 12-year-old can influence their parents forcing them to get a vaccine. If you say, "Ooh, is that the one that lets me have sex?" your parent is much less likely to force you to get the vaccine. Even though you're 12, you still have influence over parents. Now, that may be a more generational thing. But those 50% plus that say that the needle fear was why they didn't want to get the second HPV vaccine, as they get older, they learn how to rationalize. And you don't want to be perceived as weak in our society. And certainly anyone in healthcare and anyone who's looking for a vaccine or who themselves doesn't understand needle fear is going to have derision for anyone that says that they're afraid of needles. So because of that, people start coming up with other reasons why they say they don't like needles, when in fact, it may be the needle itself. Case in point. So Dan Salmon was one of the first people who researched vaccine hesitancy. And what Salmon said in his 2005 paper in Pediatrics was that the biggest difference between fully vaccinating parents and partially vaccinating parents was that the people who didn't let their kids get all the vaccines were afraid of danger from the vaccine itself or afraid of overloading the immune system. But when they asked those parents who were vaccine hesitant what the most acceptable vaccine was to them, the most acceptable vaccine to them was polio. Now, this is really interesting because if you think about how data collection and writing studies goes, this was published in 2005, which means that the people were interviewed and the parents they asked about vaccinations were collected in 2003, 2004. And they were done with their vaccination series, which means that their kids got vaccinated in the late 90s, early 2000s. And guess what? At that time, polio was an oral vaccine. And not only was it an oral vaccine, it was an oral vaccine that was highly immunogenic because it was an inactivated live vaccine. And because it was so amazingly immunogenic, if you had an immune deficiency, about 1 in a million of those kids developed polio. So you've got a vaccine that's highly influences your immune system, and itself can actually be dangerous, which is why we give injected polio now. And yet that was the vaccine that those guys said they would take, even though the reasons they gave for not wanting vaccines were different. What was really different was one of them was given by mouth and the rest of them were given with needles. So let's look at the needle aspect of it. Now, there's a lot of conflation of needle fear and fainting. The reality is that fainting and fear are different. You can become afraid because you're likely to faint, but it doesn't necessarily equate to fear. There are plenty of people who have this vasovagal fainting response that is just their body's parasympathetic system making them have their blood pressure drop. And it doesn't matter whether they're afraid or whether they're as brave as can be, they're going to go down. Now, this fainting and vasovagal response, the actual passing out is only about 0.1 to 0.3%. So maybe 1 in 1,000 to 3 in 1,000. But you can get this feeling with a lot of other aspects that figure into it. One of the misconceptions about needle fear is that you can get tattooed with a needle, and that means that you're not afraid of needles. This vasovagal response, the thing that causes people to faint, is actually caused by a nerve called the vagus nerve. Vagus is the same root word as vagabond. It wanders all over the body, and its job is to calm you down. So as this nerve is wrapping around various different veins and body parts, one of the things it does is wrap around your blood vessels. So when you go deep into a muscle, or when you put an IV catheter into a vein, you're actually directly triggering this vagus nerve to lower your blood pressure. A surface needle on the skin, like a tattoo, is a different thing. It doesn't cause the same response. But if you've ever had a vasovagal response and gotten lightheaded, nauseous, or clammy, or felt faint, you really don't like repeating that experience again. So I told you I was going to get really sciencey and wear my science coat, but bear with me because this slide really is worth understanding if you want to unpack needle fear and what we need to do to make sure people get the COVID vaccine. All right, so Chris France does this work. He is an Ohio researcher who looks at donating blood again. So these are people who donate blood, and he tries to figure out what's the likelihood that they will donate blood again. And what he found is all of these different factors, like have they donated before? Are they male or female? Are they anxious? Does it hurt when they actually have the needle pain? And do they have the BDRI, which is blood draw reaction index? Do they feel lightheaded and stuff after it? So what he found was that this 4-item lightheaded, weakness, passing out, or nauseous, these 4 symptoms strongly related to whether or not somebody was going to come back and donate blood again. The parts that fed into this were also anxiety. If they were anxious, they were directly less likely to come back a second time. If it hurt, the anxiety increased the likelihood that they would feel pain, and feeling pain itself made them less likely to go back and get blood again. That's that 0.293 thing. There you go, right there. So it made them less likely to come back, but it made them more likely to get lightheaded and fainty feeling. And if they had this positive lightheaded, fainty feeling, they were a lot less likely here to come back again. Why is this relevant, you ask? This is for blood donation. 2 reasons. 1, we can address anxiety and pain and the fainting feeling. 2nd reason is because if we want to get to herd immunity, we have to have everybody that gets their first shot also get the 2nd shot. Because if you just get one, the immunity is already down to 50% by 1 month in, and it keeps dropping. So we're not going to get this long-time herd immunity if we have people that aren't getting their 2nd shot. And we've got good data on who doesn't get a second procedure and why they don't. So going back to our slides. All right, so those are the factors that contribute to this lightheaded feeling. Turns out that the best way to address the lightheaded feeling is just to ask people, how afraid are you of having blood drawn out of your arm? And if they are, then you say, well, we're going to do stuff that's better. What you want to do is address pain, fear, and focus for anyone that doesn't like needles or has had a bad needle experience. And the best thing is just to ask a benign question like, do you enjoy a blood draw? And if they say, I don't mind, go about their business. But if they say nobody likes needles, then have something quick to address pain, fear, and focus. That leaves them with a better memory, so the next time they're more likely to come back and get that 2nd shot. All right, so what we know about people who are not coming back for their injections is that this was a study using Buzzy, and it took 3 good experiences before pain and fear dropped by half. We don't really have that much time with the COVID vaccine, but what we need to do is give people as much trust as possible that we can make the vaccine better. The other thing is that because needle fear has a huge stigma, it's a lot better for us to focus on the soreness of the arm the next day. The thing is that you may not be afraid of needles, but if you've got a job where you need to move your arm up and down, then you don't want to have the arm soreness that is associated with both the Moderna and the Pfizer vaccines. So one thing to do with this is to take the only device proven for pain and tenderize the arm before the vaccine for 60 seconds, slide it up, do the vaccine, and then put it on afterwards for another 60 seconds. What we're doing then is separating the muscle fibers that can lead to pain and tension so that the next day the vaccine is a lot less painful. Now, what we know about needle fear and about how you give injections is that you want to put the device between the brain and the pain. So you hold it on where the shot's going to go, slide it above during the shot, and then slide it back down later. Because the nerves run in paths, you need to make sure that the Buzzy is directly above where the injection is going to be given to block the nerves that cause fainting. All right, this is the last of the complicated slides, but this is all really, really new. It's understandable that people in the medical community may not know this. The deal is that what we're doing by counter-stimulating pain is we're activating this Pacinian corpuscle. This is the one, this is light touch nerve, this is a stretching nerve, this nerve feels pressure, but the one that makes the most difference for pain is the deepest one that tells where your body is in space. So if you think about banging your hand with a hammer, slamming like this with your hand stops the pain because all you feel is the fact that your body is moving. Those position sense nerves are exquisitely sensitive because they've got to be able to tell with tiny micro movements where your body is in space, and they respond to a really high frequency. That's why the device that we're using is super high frequency, so that it can stimulate those Pacinian position sense nerves and it overrides pain. It blocks it out because it's much more important to the body that you know where your body is so you can precisely run away from the threat that caused pain than it is to continue having pain. So you've got a web of pain nerves that go to the spine. You've got all these other sensations that go to the spine. And once you get to the spine, if you've strongly stimulated motion enough, then the only thing that goes up to the brain is the vibration feeling. The mechanical stimulation overrides the pain. So I could say a lot more about this, but quickly, so that we understand what we need to do for COVID. We need to address the pain, the fear, and then the focus of people that's causing them to be anxious. So what we want to do is stimulate the nerves to block pain, give them an option so they feel empowered, and then give them something so that they don't feel pain the next day to make it even better. Now, this is the other big thing that has annoyed me about the research that's being presented in all of these articles about needle fear. Topical anesthetics are not as well studied for injections as Buzzy. There are very few topical anesthetic studies looking at injections, and the ones that are out there show it doesn't help for pain. Buzzy is using the frequency to jam the pain signal and has been studied in over 50 different studies, adults and kids. The other thing is Buzzy is not distracting somebody from the site. It actually pulls your attention to what's going on. But what it does do is empower patients so that they feel like, you know, I have this in my hand and I know that it helps. I'm going to do something with it and I'm taking some control on this situation. The other thing is that for people who've had been afraid of needles for a long time, you still need to give them something else to focus on. And it's really quick and easy to put a sentence on the wall that someone can read that decreases the pain by half if they've got a good anterior cingulate gyrus stimulating task. So to sum up, it's not 7% of the population that's afraid of needles. It's more like 28% of the adult population. Needle fear is not the same as fainting. They can overlap, but they're not the same. Anxiety does contribute to lightheadedness and feeling faint. And if you have pain or anxiety or lightheadedness, you're less likely to come back for your second injection. So what we need to do for needle fear is we need to give people something that will allow them to address an issue other than fear, because our society doesn't tolerate fear. But if you want to get your patients immunized, you need to acknowledge that the way that you understand and perceive needles is not the way that people born after 1982 do. It's a different world now. And if you want to get people vaccinated, then give them something that can help make it feel better the next day. But by the way, at the same time, it's going to block that feigning response, and it's going to decrease pain between 70 and 80%, depending on whether you're a kid or adult and what study you're looking at. It has overwhelmingly been more proven that high frequency vibration and Buzzy works for needle pain. Nothing else is out there that's been proven. Why aren't we doing this? Very happy, as always, to answer questions. If you don't like needles yourself, we have a video that says how to not freak out when getting a COVID vaccine. And it gives you very practical tips, not only if you are someone who has had an experience when you were young that's made you afraid of needles, but also if you're one of those people who physiologically is more likely to pass out. Please contact us if you've got any questions. Buzzy is available at paincarelabs.com. And if you're in the public health department and would like any more information, please contact me directly at Baxter@paincarelabs.com. And golly, if we can get out there and get everybody vaccinated and take them where they are and not judge why they may or may not be getting vaccinated, then we got a really good shot at herd immunity. If we don't address the people that are afraid of needles, that faint, or that have multiple reasons why they don't want to get vaccinated that they haven't really evaluated, if we don't give them some way to climb back onto the vaccination bandwagon and go to work the next day without worrying about having a massively sore arm, we're not going to get to herd immunity. It's just not going to happen. So let's be reality-based and science-based and not based on our own preconceived ideas about what needle fear is or isn't. Science is the way forward here. And if we do that, you know, it's going to be fine.